So let's first talk about what osteoporosis is. It's a disease of the bones, and it's a disease that thins and weakens the bones. So they become fragile and they break easily, and broken hips are the #1 cause of fatalities within a year in men. Crazy, but true. So that's kind of something new that I just found out. I thought it was very interesting that men are less frequent. They don't get osteoporosis frequently, but if they have it and they break a hip, they have an increased risk of fatality within a year. So I thought that was kind of crazy. Osteopenia is a predecessor to osteoporosis. It's a condition where your bone density is lower than it should be for your age. It's on a track to possibly become osteoporosis, but this is where the bone tests to test for bone density and for resorption, which is something new I'm going to share with you. These are where we figure out what our numbers are and what we should do about it, because the transition from osteopenia to osteoporosis can be quick. It can be never, or you can skip osteopenia and go directly to osteoporosis. Changes are slow in bone density values. So it's important to maintain all the other things that you're going to learn about today in terms of keeping those bones strong, because visually seeing a number on a scan it takes a long time. So that's why we want to be mindful and careful about what we're doing to prevent that. Okay, so these are risk factors that we can't control, and this applies to every single disease process. Just is the way it goes. We can't control our age. We can't control our gender. We cannot control our family history. Previous fracture, what that means is after the age of 50, if you have had a fracture, these are not fractures that happen when you're 12 and 13. Those are different. But that is a risk factor you can't control. And then this obviously only applies to women, but menopause and hysterectomy, we can't control when we go into menopause and if we've had a hysterectomy. And things have changed in that arena as well, even for those of us that are way past both of those. And then certain medications, of course, we can't control what the medications do to cause a negative effect on our bones. It's always a game of what is more important. Is it more important for us to take the steroid or something for another disease process and just be careful with our bones? It's always we always have to look at the risk and the benefit of everything. So then we move on to risk factors that we can control. Alcohol use, smoking, weight, diet, and exercise. Those all go together. The interesting part about this is that it takes a lot of alcohol, over many years to really have an effect on your bones. So if you're enjoying your wine or two every night, please do that. It's much better for your life. But smoking is really bad at any time. Smoking, they have found, directly pulls the bone out of, pulls the bony material out of the bone. It's like it's like a syringe. So smoking is bad. So weight, diet, and exercise, obviously they're all related. Weight is very interesting because thin people that don't weigh a lot actually frequently have a higher risk of bone disease because their bones aren't strong enough, they're not big enough and strong enough to maintain the structure of their skeleton. Being too heavy, obesity, is the opposite because you're putting so much weight on the joints and therefore on the bones that is a negative as well. It's a catch-22, but that's why weight is very, very important to kind of monitor where you fall. there's, skinny fat is an actual term, and it can apply to heart, to bone, to, a lot of disease processes. You could be skinny and not be healthy. You can be thin and be healthy. You can be a larger person and be very healthy. It's all about how your weight is distributed and what you're doing. If you're moving your body and you're feeding it really good things, then sometimes it's better to have a few extra pounds. Okay. So depleting our stores of calcium, of vitamin D, of all the things that we store up is really a bad idea, because we rely on those stores to help us during the times we can't either make enough or get enough. And then exercise we will talk about. All right. So let's talk about the two most important components to bone health. The first one is calcium, and the food sources that have a lot of calcium. Nothing has a ton of calcium. Okay. Nothing has a ton of calcium. I mean, you could eat, it takes a lot to get to 1,200 milligrams a day, which is the recommended amount of milligrams per day for in our age group. It's not that hard to get to if you do consume, 2 cups of equivalent of cheese, yogurt, milk, and also some other protein-based highly calcium foods like, sardines, salmon, tofu is calcium fortified with something called calcium sulfate. Yes, Denise.
Now, when does it become dangerous for people to have
Could you say that again? When does what become dangerous?
When it becomes dangerous for people to have calcium? Because okay, I bought, well, it was in my insurance, over the counter, bought some calcium pills. Because I have, they say I have osteoarthritis. And so I thought, it's time for me to start taking calcium pills. So some kind of calcium, because I'm already on vitamin D. But I'm doing some reading, and there's some doctors that say there's a danger in some calcium. Now I'm trying to figure out who's not should be having calcium.
So, calcium is a very, very, very sensitive measure in our blood, and it can easily be measured on a blood test. Too much calcium is not good. It's hard to get too much calcium from food. And so the question is what, milligrams of calcium you're taking in pill form. And that's something I think to discuss with your doctor, and maybe look at a recent blood test and see where your calcium is at. But calcium fluctuates a lot. And so it is you can have high calcium one day and normal in 5 hours. It happens to be one of those blood measurements that really is sensitive to disease processes, to medications, to our everything, our metabolism and everything else.